Can portosystemic shunts become blocked after surgery? Imagine rerouting blood flow in the body to ease pressure on the liver. That's what portosystemic shunt procedures aim to do. These surgeries help manage complications of liver disease, like high blood pressure in the portal vein. But just like any plumbing system, these shunts can sometimes face problems. One common concern is whether they can become blocked after the operation. Yes, portosystemic shunts can become blocked or narrowed after surgery. This problem is known as shunt occlusion or thrombosis. It happens when blood clots form inside the shunt or when the shunt narrows, reducing blood flow. In procedures like the Transjugular Intrahepatic Portosystemic Shunt, or TIPS, the risk of blockage is significant enough that many patients need additional procedures to keep the shunt open. Studies show that between 70 and 90% of patients may require reintervention within 2 years to maintain proper blood flow. Thrombosis, or blood clot formation, occurs in fewer than 5% of cases, but it remains a concern. Using covered stents, which are lined with materials like polytetrafluoroethylene, has helped lower the risk of clotting compared to older, bare metal stents. When a blockage does happen, doctors often perform procedures like angioplasty, which uses a small balloon to widen the shunt, or thrombolysis, which dissolves blood clots. Currently, evidence does not strongly support the routine use of blood thinners to prevent thrombosis, but ongoing research continues. For surgically created portosystemic shunts, blockage can also occur, though data is less detailed. In children with congenital shunts, closing or repairing the shunt can restore normal blood flow, but it requires careful planning, especially if the portal veins are underdeveloped. While closing a shunt is different from a blockage, it highlights how complex the portal circulation can be after these procedures. In summary, shunt blockage after surgery is a known issue, especially with TIPS. The use of covered stents has improved outcomes, but reinterventions are often needed. When blockages happen, interventional radiology techniques like angioplasty and clot-dissolving treatments are used to restore blood flow. Surgical shunts can also become compromised, but with proper management, blood flow can often be reestablished. For those with liver conditions, keeping the shunt open is vital because a blocked shunt can worsen portal hypertension and lead to further liver problems. Patients should be monitored closely after surgery for signs of shunt dysfunction and seek prompt medical care if issues arise. Always remember, individual cases vary, so discussing your specific situation with a healthcare professional is essential. This approach ensures the best possible outcome and helps manage the risks associated with these procedures.